I'm going to start off with a question for Alison and Nyasha, who led our session on ending HIV criminalization in the context of breast and chest feeding. Alison and Nyasha, why are global governmental or non-governmental bodies not considering or taking seriously the new U=U breastfeeding guidance?
Go ahead, Nyasha, or shall I? In terms of U=U and breastfeeding, it seems there isn't really an international consensus yet. What we see is in some countries, guidelines are changing. Those are the medical guidelines in terms of what healthcare providers tell to women living with HIV. And we do see in several countries studies being done, Italy, Switzerland, Germany, the UK, US, to gather more information on the transmission risk. But it isn't a global consensus that U=U in the breastfeeding scenario. It's just changing guidelines in a few places. So there isn't that consensus yet that people can use. But what we are seeing is a lot of evidence evolving and coming out to make a much more robust case. And so hopefully prosecutors will be able to take that into consideration. Governments will take that into consideration. And we as a global community can mobilize around the science and the human rights considerations and stop further criminalization of breastfeeding, chest feeding, and comfort nursing.
Excellent. Thank you, Alison. Nyasha, I'm sorry, did you want to follow up before I move on?
I think very quickly to add one thing, at least in the African context, that current recommendations for women living with HIV actually recommend breastfeeding. And I think this is important to note for various reasons, one including the fact that that is what is actually affordable, and kind of when that risk and benefit analysis is done, it's ways in actually recommending breastfeeding. And so I do think that this is important for, prosecutions, and the very idea that then doesn't make sense when the recommendation is that women living with HIV should be breastfeeding, because that is actually what is best for children.
Excellent. Thank you so much for those answers. So, I'm hearing a lot of from those responses that there's lack of consistency in knowledge, data, as well as guidelines to inform, even a local or domestic response, let alone a global. And so from that, I hear, that there is still a lot of challenges to understanding science, as well as the merging of human rights in context of the science that informs our guidelines and campaigns. And so